UroPatient. Tune in and see, empowering your health for you and me, you and me. Knowledge is power, power. We make it clear every Saturday morning. The podcast is here.
Hey, good morning. Yes, the podcast is here. I'm your host, Vic Senese, and welcome to the UroPatient podcast. Hey, if this is your first time checking us out, be sure to like and subscribe. So today we're going to follow up on something that we talked about last week, the radical cystectomy, removal of the bladder, your whole bladder out because of bladder cancer. Last week we talked about what an ileoconduit was. That's an appliance that you end up having to wear a bag on your side to take the place of the bladder that was removed. Well, there's another option, and we're going to talk about that today, and that's called the NeoBladder, where we actually create a bladder for you from your bowel. And we'll talk about that now so you can learn about that. So last week, we explored the ileoconduit, the most common type of urinary diversion after bladder removal surgery. Today, we're taking the next step by discussing what is a NeoBladder and is it right for me? I'll discuss how a NeoBladder is created, who could be a candidate, what the recovery is like, and the benefits and challenges of living with this remarkable bladder construction. A NeoBladder is a new bladder that a surgeon creates using a small section of your intestine after the bladder has been removed, usually because of bladder cancer. The intestinal tissue is reshaped into a pouch and connected to your ureters and urethra, allowing many people to urinate in a way that's pretty similar to before surgery without needing an external urine collection bag. Now, while a NeoBladder can provide a more natural way to store and pass urine, it takes time and practice to learn how to empty this properly. Now, here's the steps to creating a NeoBladder for your surgeon. It involves basically three main surgical steps. Step one, the surgeon carefully has to isolate a short segment of the small intestine while preserving the rest of the bowel so it continues to function normally. So you can see from this picture here, that little section is removed. Step two, that piece over here, that piece of intestine is opened and reshaped from a tube into a rounded, low-pressure pouch that can store urine, much like a natural bladder. And then finally, step three, over there, the ureters, which carry the urine from the kidneys, are connected to that new bladder, and the NeoBladder is then attached to the urethra so urine can leave the body through the normal pathway. Although this reconstruction is complex, it allows many patients to urinate without wearing an external urine collection bag. Now, today we're looking at how your urinary tract is changed also before and after surgery. It's not quite the same. So before surgery, the urine flowed from the kidneys to your bladder, and now your NeoBladder captures and stores that urine internally, like the old bladder did. To pass urine, you will have to use your natural urethra simply by relaxing your pelvic floor and gently bearing down. So you can kind of see from these pictures the before and after. NeoBladder surgery is a major operation, typically lasts about 6 to 8 hours. I think it's probably one of the longest operations that we do in urology. After surgery, you will spend time in the recovery area, and many patients are monitored in the intensive care unit for the first day to closely watch their heart, lungs, and overall recovery. You're going to have several tubes and drains, including a catheter to allow your new bladder to heal. One of the most important parts of recovery is following that golden rule. Get up and walk as soon as your healthcare team says it's safe. Early walking, key to recovery. It improves circulations, lowers your risk of blood clots and pneumonia. Also, we've been monkeying around with those intestines, and they kind of go to sleep from that. Helps wake them up and speed your overall recovery. Even short walks several times a day can make a big difference in how quickly you regain your strength. Now, in the early days of recovery, you're going to notice several temporary tubes. Don't worry, these are all here to help. You may have a nasogastric tube, we call it NG tube. It goes into your nose to your stomach to keep your stomach empty while your bowel's recovering. Remember, this is a bowel operation also. You will also have ureteral stents for 1 to 4 weeks to protect your kidneys. Finally, You'll rely on a urethral catheter to drain the urine, protect your new sutures, and flush out the mucus, and possibly an optional suprapubic catheter in your abdomen. So we'll decide on that at the time of surgery. Now, your NeoBladder is made from a small piece of your intestine, so it behaves differently than your natural bladder, because intestinal tissue normally produces mucus to protect itself. Your NeoBladder will continue to make mucus, especially during the first several months after surgery. So drinking plenty of fluids and following your care team's instructions for catheter irrigation, if needed, are important. Unlike a natural bladder, a NeoBladder does not have the same sensing nerves, so you may not feel the urge to urinate. Probably won't. It also cannot contract or squeeze to empty itself, which a normal bladder does. Which means you're going to need to learn how to relax your pelvic floor muscles and gently use your abdominal muscles to help it empty. With time, practice, and guidance from us, your healthcare team, most patients learn a regular schedule that allows them to manage their NeoBladder successfully. Now, here's something very important to understand. Your new bladder is made of bowel tissue, which means it does not have the natural elastic muscle of a regular bladder. It must be actively trained to stretch over the course of a year. In week 1, it holds about 100 milliliters, growing to 350 by month 6 and about 500 by month 12. Please remember this golden rule. Never allow your NeoBladder to overfill or hold more than 500 milliliters. That's about a half a quart, folks, as this can permanently overstretch or harm the tissue. To reach your capacity goals, we use the scheduled staircase like you see here. In the first week, you will need to empty your bladder every 1 to 2 hours. Over 5 weeks, you will gradually build your capacity until you can go 4 to 6 hours during the day and 6 to 8 hours at night. Now, here's a pro tip. Always set an alarm clock to wake you up in the middle of the night. Never skip avoiding time. Real important. Now let's talk about the mechanisms of emptying, known as the voiding loop. Step 1, sit all the way back on the toilet. Keep your mouth open or gently hiss through your teeth to fully relax your pelvic floor muscles. Step 2, the Valsalva maneuver. Take a deep breath, hold it, and bear down with your abdominal muscles for 10 to 15 seconds. You can even press gently above your pubic bone. Step 3, double voiding to ensure it's completely empty. That means you're doing all this stuff over again. Because your NeoBladder is made from bowel tissue, it naturally will produce mucus, as we talked about. That mucus can sometimes block catheters. You will need to gently flush it using a syringe with about 50 milliliters of room temperature normal saline. That's salt water. For the first 3 or 4 weeks after your catheter is removed. You must also check your post-void residual by self-catheterizing yourself 1 to 2 times a day. That means you're going to be putting a catheter in to drain that bladder out. See how much is left behind after you've done that maneuver to empty it. If you measure less than 50 milliliters left inside, good job. You're right on the money. You are now emptying it successfully. If it's more than 50, do not advance to the next week's schedule yet. Stay where you were. Now let's focus on your pelvic floor. While your sphincter muscles were left intact during surgery, the surrounding nerves underwent trauma. Your NeoBladder relies heavy on your pelvic floor to act as the lock that holds urine in. That means what keeps you dry. You must perform Kegel exercises every single day. Consistent practice is absolutely key to gaining full urinary control. Managing leaks can be frustrating, but please know it's entirely normal and expected for the first 4 to 10 weeks. Leakage is most common at night because your muscles naturally relax while you sleep. To mitigate this, wear protective pads or underwear to keep your skin dry. Restrict your fluid, caffeine, and alcohol intake in the evening. And once again, make sure you use that alarm clock to get up and void during the night. Now, don't forget to show some tender, loving care to your digestive system. It's been through a heck of a battle. Hydration is key. Plenty of water dilutes your urine and causes less irritation and helps prevent constipation. Steer clear of highly spicy foods, carbonated drinks in the early weeks to avoid irritating your healing tract. Instead, keep to a high-fiber diet for smooth, regular bowel movements without straining. Finally, when should you call the doctor? Mild cramping when your bladder is full, mucus in your urine, and minor leaks between voids are all normal, all to be expected. However, be sure to call your medical team immediately if you experience any of the following: an inability to empty your bladder at all, even when using a catheter, heavy bleeding in the urine, severe unmanageable pain, or high fever. Those are key. Your clinic's urology helpline number is available for you 24/7. Recovering from NeoBladder surgery is a journey, so remember, it's a marathon, not a sprint. Every week, you will gain more strength, confidence, and control as your body heals and you learn how your new bladder works. There'll be good days, challenging days, but with patience, practice, and the support of your healthcare team and your loved ones, of course, most people are able to return back to normal activities that they enjoy doing. So, stay positive, celebrate the small milestones along the way, and know that your recovery is leading you back to a full and active life. Yeah, so I hope this was helpful for those folks out there that have contemplated having to go through this big operation or have had the operation, or, maybe you're somewhere in between and, you know, this is something I put out there as it's a piece of education for you to know. There are some options, some choices. I've taken care of patients with both ileoconduits and with neobladders, and there's pros and cons to both. The neobladder is probably the closest thing you can get to a natural bladder, but it's not the same. The ileoconduits are pretty easy to handle, but you got to wear an external bag. So, it's kind of a personal choice as to how much you want to be closer to normal versus a little bit more work that you have to do with the neobladder. Now, next week, I'm going to talk about a subject that came up: MRI of the prostate. What is MRI of the prostate? Well, I'm going to do a little quick promo for that.
MRI performed. If your doctor has recommended a multiparametric prostate MRI, you may be wondering what the exam involves, whether it hurts, how long it takes, and what happens afterward. In this episode of UroPatient, host Vic Senese walks you through the entire prostate MRI experience in easy-to-understand language. Learn why this advanced test has become an important tool for detecting, evaluating, and monitoring prostate cancer, as well as helping guide MRI-targeted prostate biopsies and active surveillance. Join us on August 8th at 10:30 a.m. Central Time to learn more.
Yeah, so that'll be next week. It's going to be interesting because this is a little different from most of the things that I've talked about. I usually talk about things that I've either assisted doing or done in urology. This one I actually had to go through myself, so I'm going to give you a personal perspective. So tune in next week to learn more about what's involved with the prostate MRI. And until then, have a great rest of your week, and we'll see everybody next week.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, paving your health for you and me. Knowledge is power, power. We make it clear every Saturday morning. The podcast is here.